Thank you. Thank you so much for the kind introduction. At the outset, I'm Vivek. I work with the UNICEF's India Country Office as the Chief of Health. But at the outset, I want to congratulate the Department of Public Health, Tamil Nadu, for hosting a global conference, I'm told, for the third time in a row, and special mention to the DPH and the entire team, Dr. Selva Vinayagam. And why this is important is that when the public health department is a learning department like TN, that is where our programs and policies, they are evidence informed, and this is something which I must mention, that we must try and see how other states also learn from this very important initiative. Now, the topic that I've been given is on obesity. Just a disclaimer, I'm not an expert on this topic, but this is such a pertinent topic today, so let's see if I can do justice to this. Can someone confirm also now if you can see my slide share?
Can you have the slides?
I'll be sharing my slides, so I just want to confirm.
Yes, sir. Yes, sir. It's visible, sir. Please go ahead.
Visible?
Yeah, it's visible.
Okay. So let me take you through. There was a work done by UNICEF in collaboration with the Institute of Economic Research on overweight and obesity in children in India. The study is still very recent, so I wanted to draw a few important points from this on this topic. The context, as we all know, we have many good national and state initiatives. To mention some, Poshan Abhiyan, the Eat Right School campaign. Now we have the primary healthcare approach embedded in many of the programs, and Tamil Nadu, for example, we know is a first in many such initiatives. FSSAI, the Eat Right campaign, of course, the role of that. Now, the research questions in this study is who's affected, and where is the situation worsening, improving, and risk predictors of overweight and obesity, and factors shaping the obesogenic environment overall. And these were the sources from where the information was collected. So while point prevalence is less than 5% in numbers, 17 million children 5 to 9 years are overweight in the country. And of the children who are overweight, 1 in 2 suffer from more than 2 micronutrient deficiencies, and 1 in 4 from anemia and poor lipid profile. And these are the results from the study. Now, important to note, there is no significant gender difference. Prevalence is higher in urban areas and high income groups. 11 of 28 states in India have high prevalence, greater than 10%. And I see TN is, and also sometimes, the sources of information is in the darker blue category. Then pace of increase is faster in rural, while it would be higher in the urban compared to urban, and highest in the lowest wealth quintile. So important to note this dual burden of malnutrition. So on one side, while we are still tackling wasting and stunting, we also have now this overweight and obesity, and increasing higher rate in the rural population, although the overall current still may be urban. And if unchecked, 17 million 5 to 9 years overweight will become 27 million by 2030, which will comprise of 11% of the total global burden by 2030. And we can see it's a no-brainer, but increased screen time, and in the overweight category, what kind of food choices is more. So that's also something we need to note. Now, how to tackle these environments? What are some of the targets, programs, legislation? So for 0 to 9, there was a target of no increase in overweight obesity by 2025. The WHO set target. Now, this is something where we first need to regularly keep tracking the numbers to be able to do that. Now, what are the programs? So food-based social protection programs, high in sugar and oil, across service delivery platforms. This is an area where we can look at some efforts by MOHFW and FSSAI. School health initiative is shaping the behavior, and that should be leveraged more. Taxation on aerated and caffeinated beverages is higher than on processed packed food, and lessons from discontinuation of fat tax in Kerala points at bringing Indian local snacks beverages in the ambit of regulation in future. Then front of pack labeling with WHO Southeast Asia Regional Office aligned warning thresholds. They are under debate. No regulation on nutritional information menus at eateries. Then several legislation that are to be rolled out, restrictions of sale and advertisement within 50 meter. We know these provisions are there. Advertisement, promotion, sale or consumption of these foods, and penalizing endorsers under Consumer Protection Act of the 2019. And sales of confectionery increase almost 10 times more than the pulses in the country. And there is data across different states also available on this, so that states can take appropriate action. Then there is possibility of influencing behavior through Eat Right India and sedentary lifestyle. So how to work with multiple sectors to provide the environment for greater physical activity starting from the childhood and school. And then the opportunities for multi-sectoral collaborations, because we know this is not an area where health often does the mopping up of policies gone wrong in other sectors, and more so in this area. So multi-sectoral collaborations are something which are very important. Then counseling and mass communication material is something that we all can increase work on. And annual state-wise reports on compliance, then examine domestic and international evidence on the impact of use of fiscal instruments on sale of unhealthy food, and test and evaluate overweight and obesity prevention and management in children's preschool and school health programs, especially in the hotspot districts if we have data like this. So see, these are some of the suggestions also that emerge from the report. And then we know shaping the food environment around the sale and marketing, the FSSAI school campaigns, and the advertisement code for Ministry of Information and Broadcasting for these kind of foods, and how to enforce this. Then this shaping the food environment, we know there are many good practices, and I was reading that even in Tamil Nadu, we have many examples. So this is one area certainly where we need to push harder, and this is an available platform to stop this increase in overweight and obesity. I'll not go into the detail of this, where we had seen that there is increase in sugary and other confectionery 10 times over pulses across the country. But this is a report which is worth going through in full. And this is available online in the Institute of Economic Research and also UNICEF's website. Now, having said that, I also want to highlight this is an opportunity to mention that UNICEF for the first time in India is including a program portfolio for NCDs and children. And the idea literally is that we need to move beyond just the survival to survive, thrive, and give every child the opportunity to transform their health and human potential. And we know that the epi-transition, how the NCDs are increasing and increasing even in adolescents and children. So UNICEF now in India, in its 2023 to 27 5-year program, has a portfolio of NCDs and children, and we will begin from this January, and very happy that we are actually beginning this program portfolio also from the 5 southern and western states, which includes Tamil Nadu, and also a program on inclusive early childhood development, so that there is greater focus on the developmental disabilities that can be avoided either or managed better, and also birth defects, some of which can be so easily prevented. And we have seen how states like Tamil Nadu, Kerala, and some of the other states where there is more space in the health system because of reducing mortality burden to take on such development issues. And we do acknowledge that there is this unfinished agenda. States like Tamil Nadu, Kerala, Goa, and others have now even achieved single-digit child mortality, newborn mortality, which India has, aspired to reduce to single digit by 2030. Many states are on the track, but a few will also miss. But most importantly, states like Tamil Nadu now have the plasticity in the health system to focus on these development issues. Now, what is important for an issue like childhood overweight or obesity or NCDs is the life course approach that we need to keep in mind. And as UNICEF, we will try work with the governments to ensure that this point is emphasized over and over again, that across the life course, we have a lot of programs and interventions where there are opportunities for early life course health promotion and also primordial and primary prevention for NCDs, including overweight and obesity, and these should be leveraged. So from maternal and newborn health to child health and well-being and then beyond, there are so many platforms available that should be leveraged, and focusing on prevention of childhood NCDs through this life course approach. But what is important to note, and this is relevant for all these states as well, that while there are opportunities for early life prevention of non-communicable diseases, so there should be one pillar clearly focusing on these prevention and promotion opportunities. But there should be another pillar, and which will be there in UNICEF's program with the states, that is trying to provide quality care as possible, as close to the community as possible for children who are already suffering from some of the childhood onset NCDs. So for example, type 1 diabetes, sickle cell, rheumatic and congenital heart disease, more so the congenital heart disease and childhood cancers are just examples where children are already suffering from the childhood onset NCDs, and how can systems be more responsive to ensure quality care as close to the community as possible. So for example, I'm also aware, I was reading that Tamil Nadu also has enhanced its program on type 1 diabetes, for example, but many states, despite the fact that there is enough money in NHM to provision insulin up to the front lines, but just the knowledge in every district health system or the state that there would be a specific type of insulin, for example, required for children who are type 1 diabetic than usually the one available for adults, the mixed versus the basal bolus regime. And so these kind of tweaks, and especially when in India there is no dearth of resources in the program, these kind of tweaks are immediately required in system so that children who are suffering from NCDs also get universal quality care. Because globally, this NCD care has been oversimplified into just adult the cardiometabolic diseases. And there are a lot of opportunities where we can extend it to children and adolescents because of the epidemiologic profile shift. So just to reiterate that UNICEF's approach when we would be working with the states on this issue and any other issue is the primary healthcare approach, where we ensure that communities are at the core of our program design and delivery, where we provide communities with the knowledge and the tools to do three things. First is some accountability. With the rights also comes the responsibility. So some accountability of self-care, of doing the right things, the healthy things. Then also knowledge and the tools to participate in their health planning in the village health committees or the hospital committees. And third is knowledge and tools to be able to demand quality services. So advocating for every child through this community empowerment, and of course, strengthening service delivery in the primary healthcare system. And we also have a lot to learn from Tamil Nadu's the logistics and supply chain and drug procurement, that how to ensure these commodities up to the front lines. So thank you very much, and I hope I've kept to my time. But this is a nutshell of the work that UNICEF has now started on non-communicable diseases. And essentially, it's the first time in our 5-year program portfolio in the country. Because of the epidemiologic transition, this has become such an pertinent topic, and I'm so happy that the conference and the Tamil Nadu Department of Public Health has decided to prioritize this topic. Thank you very much.
Thank you, sir. It's a great pleasure to have you here. So as rightly said, during 1990s, we have plenty of marasmus and kwashiorkor. Nowadays, only obesity. So in those days, we used to conduct chubby baby clinic. Right now, we have to see that we have to go for a lean baby clinic or healthy baby clinic. So this is a concept of all the other things, whatever you have. As you highlighted, the legislations, the 50 meters from school, there is no junk food or no advertisement. It is really a news for us, and we will try to cope up with the things. And as you rightly said, it should be a multi-sectoral approach. We'll try to incorporate. Any question from audience? Okay. So thank you, sir. Thanks for your excellent speech on childhood obesity, sir. Thank you. Thank you very much.
Thank you for including me, and all the best for the conference.
Thank you, sir. Thank you.